Hello and welcome to Med News India, your trusted source for reliable health updates and expert guidance. Before going ahead, I request you to like and subscribe our channel for regular health updates. I'm Dushyant Magu and today I'm thrilled to be joined by Dr. Sukriti Gupta, a hematologist from Paras Hospital, Gurugram. She'll guide us through childhood blood cancers, innovative therapies for kids, and how modern medicine is improving pediatric care. So whether you are a patient, caregiver, or simply interested, this conversation is packed with important facts and valuable information. Let's begin. Welcome, Dr. Sukriti. We are honored to have you with us today.
Thank you.
To begin our discussion, can you explain what are the early warning signs of blood cancer in children and adults?
So when we talk about blood cancers, be it children or adults, there are no 2 or 3 particular specific signs that we can say that this will indicate a specific diagnosis of blood cancer. The signs are relatively non-specific, like a prolonged fever, some painless skin rashes or nodules appearing, and which are progressive with time, and they are not responding to medications. Most importantly, the routine medications, antibiotics that we use for fever or any other infections, these patients are non-responsive to all these. Apart from that, some patients can manifest with bleeding manifestations. They can have weight loss, loss of appetite. So overall, there are non-specific symptoms, and we need to recognize them timely once they are non-responsive to routine medications, and we need to consult an expert.
Why are many pediatric cancer cases misdiagnosed in the early stages? And can you tell us about a misdiagnosed case?
Yeah, so the pediatric blood disorders, like I said, they resemble many other disorders like infections. They can also resemble other disorders like rheumatological disorders, where there is non-specific back pains, joint pains, and swellings. So some of our patients have been misdiagnosed as tubercular infections, and even cases of juvenile rheumatoid arthritis, where they have been exposed to steroids for indefinite periods. And because of this, they have partially shown response in the initial stages, but with time, the response wanes off because they are only partially treated with agents like steroids and other non-specific immunosuppressants. And they haven't been directed to any specific therapy for leukemia or lymphoma. So once we see this waxing and waning course, where there is an initial response, but there is reappearance of symptoms, then we should definitely think of blood disorders, especially when there is some drop in hemoglobin, platelet, or white cell count, which has been noticed in these patients over time.
What is the success rate of bone marrow transplant in children with leukemia?
When we talk about leukemias in children, so first of all, it is important to understand not all patients with leukemia would need a bone marrow transplant. Most of patients of leukemias will respond to only chemotherapies. Most common leukemia in children is acute lymphoblastic leukemia, and the first line treatment will be chemotherapy only. And we can say around 80% children will respond to chemotherapy alone. But beyond that, yes, there are certain high risk cases. High risk we define based on certain genetic parameters called cytogenetics, or based on some next generation sequencing panels, which we do in all patients of leukemias. So in these patients, whenever it is defined as a high risk leukemia, or in cases of acute myeloid leukemia, it is preferable that we go for an upfront transplant. Otherwise, transplant is usually indicated in cases of relapsed or refractory leukemias who do not respond with chemotherapies. And in terms of outcome, we can say even in relapsed or refractory or high-risk cases of leukemias, the overall outcome is approximately 60 to 70% broadly in children.
Is bone marrow biopsy painful? How is it done, especially in children?
Okay. First of all, a bone marrow biopsy is invasive, but it is minimally invasive test. It doesn't really have any complications. We subject the child to bone marrow aspiration or biopsy only if it is definitely indicated, and we have to rule out any hematopoietic disorder. So it is always done after admission of the child in a daycare basis, usually, where we give sedation to the child so that the child is made to sleep and the child is calm, comfortable, and only then do we do a bone marrow biopsy from the hip bone. We don't touch the spine in any case of bone marrow biopsy, and there is no cutting, stitching involved in any bone marrow biopsy. So we have to understand there are no particular complications related to a bone marrow biopsy. There can be mild pain at the local site or bleeding just after the procedure, and sometimes sedation related very minimal problems arise, but they can be well managed. So whenever a bone marrow biopsy is indicated and advised by an expert, it should definitely be done.
Do alternative therapies like Ayurveda or homeopathy interfere with cancer treatments?
So patients who believe in Ayurveda and homeopathy, most common myth we have come across is they feel that all these therapies are without any side effects, which really fascinates them, that there is no side effects involved with Ayurvedic or homeopathic and other alternate kind of treatments. But it is absolutely not true. We have seen patients taking Ayurvedic medications and coming up with some kind of liver damage, some unusual abnormal bleeding problems, which is entirely unexplained because we don't really understand, we don't really know the composition of these Ayurvedic medications which have been used and to which the patient has been exposed. So it is in these cases difficult to manage, and the basic underlying disease gets overlooked, it gets missed, and the treatment is also delayed. So especially in cases of cancers, we'll say that the Ayurvedic and homeopathic medications should really take a back seat, and there is no medications without any side effect.
What are the prospects of gene therapy as a potential cure for sickle cell disease and thalassemia?
So, well, gene therapy is very much talked about nowadays. It is an upcoming therapy. It has undergone a few trials in various countries. It is even undergoing a phase 1 trial which has been started in some areas in India. But as of now, it is not a clear-cut beneficial option. Definitely in the long term, we see it as an option because there involves a gene editing. At the bone marrow level, there will be a gene editing because of which there would be a normal blood formation in all these patients of sickle cell anemia and thalassemia. But however, this is right now absolutely under trial. The definite management still involves a bone marrow transplant in sickle cell and thalassemia. Future prospects, we see lesser side effects and good outcomes in gene therapy, but accessibility and affordability becomes really challenging in case of gene therapy.
Thank you so much, Dr. Sukriti, for sharing your valuable insights with us today. I'm sure it will definitely help many of our viewers better understand blood disorders and the latest treatment options.
Thank you, Dushyant, and thank you, Team MedSurg India, for having me here today.
To all our viewers, especially parents and caregivers, facing blood disorder in your child can be overwhelming, but you're not alone. With the right knowledge, expert care and support, there is a hope and path forward. At MedNews India, we are dedicated in supporting family like yours and connecting you with top pediatric specialists every step of the way. If you found this video helpful, don't forget to hit the like button and subscribe for more. Thanks for watching. See you in the next video.